Okay, everyone, good afternoon. We're gonna get started. We know it's a really busy day right now. And I think, there's a lot going on, and I want to be respectful of everyone's time. So I want to thank you all for coming out and joining us for this really important event, this really important announcement. I am State Representative Rick Krajewski. I am joined here by Secretary Denise Johnson, Representatives Frankel, Burgos, Guzman, and Madden, youth advocates, and we'll be joined by some impacted youth as well to make a really exciting announcement about changes to the birth certificate application process, particularly to help our most disadvantaged youth. And I will admit, given everything that's been going on today, I was like, man, I don't know how we're gonna fit a press conference in all this. But if anything, I believe that this political moment affirms why this critical change in allowing our youth to access their vital documents is so important. And so just a little bit about myself. I represent the 188th District in West and Southwest Philadelphia. It is a district that I love, a district that I love to call my home. We have a very rich and diverse community, and like many places in Philadelphia, we are dealing with a very real issue around gun violence. I've had constituents come to my office, I've had them email me, I've had them share stories about loved ones, community members, residents, children that have been lost to this crisis. And as we know, often the people on either sides of this issue are getting younger and younger. And so for me, as a state legislator, as a young person, as someone who really feels invested in the future of our young people, I felt called to do something. I felt called to look out for my community, to figure out how we can actually invest in our youth and put them on the right track. How can we invest in the things that we know will actually help us break this cycle of violence once and for all? And I am really fortunate in that I am not alone in that fight and in that struggle. In fact, this particular issue was brought to me by a really exciting organization that we'll hopefully hear from later in this conference called Yeah Philly. Yeah Philly works with at-risk young people in the heart of West Philadelphia. I'm proud to call them residents of my district in the 188th. And this is an organization that works day in and day out with young people who are directly impacted, who are the most at risk for gun violence. And they really work with these young people. They build relationships with them. They give them a home. They help them stay clothed and fed, and just really are a strong support system for the youth that we often talk about in this building. We often talk about trying to save their lives, trying to make sure they have the things that they need. And Yeah Philly brought this issue to me, where they said that they had countless youth who wanted to get a job, who wanted to access their social benefits, who actually wanted to take the steps to pull themselves out of poverty, to actually break the cycles of violence that them and their friends are often ensnared in. But they were having this issue where maybe they were homeless, maybe they're in between homes, maybe they're in the foster care system and didn't have a relationship with their parent. They might be juvenile justice impacted. They might be caught up in a jail waiting for their sentence or waiting for their hearing, and they were unable to be accessing this very vital document, this birth certificate that we know is a stepping stone towards accessing all the other things that we know we need to thrive in Philadelphia, but also throughout this entire state. And so they brought this to me. They were like, Representative, these young people want to work. They want to access, social benefits, social welfare. They actually want to actually do right for their communities and show up in their communities. And this very simple change is stopping them from being able to do that and getting them caught up. And so for myself, as someone who wants to do everything I can to make sure another life is not lost, and particularly a young life is not lost, I really took that to heart. I worked with Yeah Philly to create a bill alongside Representatives Razi, Guzman, and Burgos, HB 1475, which would outline changes to the birth certificate process, lowering the age and also waiving the fee, particularly for disadvantaged youth to be able to access their birth certificates. And from there, we went to work. We're like, okay, we know this is going to be in the Health Committee. How can we actually work together, work with colleagues that we know care about this issue, and really get this across the finish line. So I'm eternally grateful for Chairman Dan Frankel and the Health Committee for all of his leadership in working with our office, his staff. Chairwoman Kathy Rapp, also a big supporter in this bill, really helped us talk not just to Democrats but also Republicans about why this was an issue that was not just important for Philadelphia but across the state. And I'm really fortunate that we're able to not only get the bill up for a vote, we're able to pass it out of Health Committee unanimously. And then from there, I'm so grateful for the Department of Health and for Secretary Johnson for coming to us and saying, hey, look, we hear you. We hear this is really important for our communities here. How can we actually make this happen? And so I am really proud to say that today, these changes are live on the Department of Health website, right? Yes. I was just talking right before this press conference how sometimes we're like, all right, we won, and it's gonna be ready in 9 months. But it's actually, it is ready now. So right now, any youth in Pennsylvania 16 and up is able to apply for their birth certificate either in person or through mail application. And for any youth that are in the foster care system, are juvenile justice impacted, or are homeless, that fee will be waived. Because we know that sometimes even something as small as $20, $30 can be the thing that stops someone from being able to take a step in the right direction or not. And so again, I'm just so grateful for all of the partners and all the people that work to make this happen. Again, it is live on the website, so if you have someone, Rep. McNeil just talked to me right before this press conference about how one of her loved ones is currently applying for this new change. So this is something that's happening right now. So really appreciate all the support. Hope everyone can help spread the word. And next, I'll be passing it to Secretary Denise Johnson. Thank you.
Good morning, everyone. I'm Dr. Denise Johnson, and I'm serving as the Acting Secretary of Health and Physician General. Thank you so much, Rep. Krajewski, for bringing this to our attention. The Department of Health processes tens of thousands of birth certificate applications every year. This year alone, we've done more than 67,000. So we had 32,000 by mail and 35,000 walk-in. And we're always looking for ways to make the process better and improved. And so when we learned that youth who were 16 and older were having difficulty accessing their birth certificates, especially those youth that were experiencing homelessness or had been involved with the juvenile justice or system or foster care, we implemented the changes that were necessary to address those issues. Until earlier this month, individuals had to be 18 or older to apply for their own birth certificate. But this is important for younger youth, as you heard, for them to be able to get a state ID or a driver's license or college application. Really, these important steps were having a barrier in place. But I'm proud to announce that as of October 3rd, when our online system began, youth that are 16 and older can come in to get their own birth certificates. We also understood that that cost was a barrier. The fee is $20, but those individuals who are now or have experienced homelessness or involved in the juvenile justice system or foster care had that barrier of that cost. And so we implemented a process to waive the costs for those individuals who are 16 to 24 who have experienced homelessness, involved in the justice juvenile system or foster care, so that they could get their birth certificates for free. Now, this is already in place, and I have to say that even last week, we had an individual who was just under 18 years old who walked into one of our offices and left with her birth certificate in hand. I need to applaud our staff at the Department of Health who are constantly working to improve the lives of Pennsylvanians and really appreciate their work on this effort. Now I'd like to introduce Rep. Frankel.
Thank you, Secretary Johnson, and thank you, Representative Krajewski. I want to congratulate the young people who will now be able to take greater control of their lives. By having access to key documents, they can go to school, get a driver's license, and find employment. Our system should not create barriers, but alleviate them. This change reflects our commitment to remove unnecessary obstacles. That sounds easy, but it's no small feat. Lawmakers and government officials, like everyone else, can get stuck in the mindset of this is how it's done and not do the work to figure out how it should be. That's why we are all lucky to have Representative Rick Krajewski. He's been tireless in his effort to highlight this problem and figure out how to solve it. Whenever we might have gotten distracted by the complexity of making change, he made sure that the young people affected were squarely at the forefront of our minds. He met with countless members working to secure votes on a bipartisan basis, helping to make sure that we all understood why this matters. And we're lucky to also have Secretary Johnson, who proved herself willing to take time to listen with an open mind and find resolution. Representative Krajewski, as a first-term legislator, put politics aside to focus on what matters, and although a signed bill doesn't have his name on it, he got the results that young people needed. On behalf of the young people in my district and the Commonwealth who benefit from this change, I'd like to extend thanks to Representative Krajewski, to the young people who came to Harrisburg to tell their stories, and to Secretary Johnson and colleagues at the Health Department who were willing to listen. Thank you very much. And are these folks here?
Yeah, we'll go to, Philly.
That's it.
Yeah, you just say yeah.
And now I'd like to introduce Yay Philly, Kendra, James, Presley. All right.
All right.
Thank you.
Thank you.
Thank you. We are so excited to be here today, and we thank Representative Rick Krajewski and all of the young people we work with so that they'll be able to get their own birth certificates easier now. And this is the first time that young people in the juvenile legal system will be able to go through and get their birth certificates for free and easier if you are in the foster care system, if you are homeless. And we are so excited that young people, not just in Philadelphia, but the entire state will be able to get the vital documents that they need. Each year at Yeah Philly, we work with about 400 young people, and less than 25 of them every year come with their vital documents. We know that we need birth certificates to get a state ID and to get a job. So this is a huge win for all the young people in Pennsylvania, and I appreciate all the young people who came here with us to advocate on their behalf for what they need. So I introduce Presley Barner because she is one of our young people who have been advocating for this.
Good morning.
Speak up.
Good morning. That's too loud. Good morning, everyone. I would just like to say this is a huge step for the youth of Philadelphia. This is a step closer to us being on our own, having our own independence, and being able to get stuff done without a parent or a guardian. Thank you. That's it.
Yeah, again, I want to say thank you. As Presley mentioned, this is a huge deal for us. This tells the story of the population that we serve in Philadelphia. And I want to take a few seconds to talk about two different young people. Last year, we met two young people who both were arrested and released from the Juvenile Detention Center. One of the young people had a supportive family and had access to all his vital documents. That young person was able to immediately start working with us, immediately get access to a state ID, and ultimately a driver's license. Another young person who happened to be his friend had all the barriers that you can imagine. He didn't have any family support. He didn't have access to any of his vital documents. And because the two differences, one young person ended up continuing to live the life he deserved. The other young person, because he wasn't able to have all the opportunities he needed and deserved, he ended up continuing to cycle out the Juvenile Detention Center. Now that these changes were amended, we're grateful because now each young person we serve has the right to their documents that they deserve, that they need, so no one will have any barriers to have any education opportunities taken away, any employment opportunities. This is a huge deal because a lot of the barriers that we see every day, especially how we tie it to poverty and violence prevention, we're able to eviled the battlefield across Pennsylvania, and we're truly grateful for this opportunity. Thank you.
Next, we will be joined by Samya Ayagari, who is a youth advocate who wants to share her experience as well. Thank you.
Good morning. My name is Samya Ayagari, and I'm a nurse home visitor with Philadelphia Nurse Family Partnership, which is part of the National Nurse-Led Care Consortium, a subsidiary of Public Health Management Corporation. My role involves working with first-time parents during the pregnancy until the time the child is 2 years old. I support parents with meeting their parenting, educational, and professional goals. Many of the parents that I work with are 16 to 24 years old and in foster care, transitioning out of foster care, or were recently in foster care. These young folks have dreams of completing their education or entering a certain profession. However, lack of access to their identification documents often prevents them from enrolling in school, applying for jobs, and applying for benefits. Many youth in foster care do not have access to their birth certificate, which is needed to obtain a Social Security card and driver's license. More specifically, I've worked with many clients whose birth certificates have been lost or damaged in the process of transitioning between homes and caregivers. Until earlier this month, a person needed to be 18 years old to be eligible to apply for access to their birth certificate. Thanks to youth advocates Rep. Krajewski and his team, minors ages 16 and older can now apply for access to their birth certificate with the support of advocates from a community-based organization. And they can even do so independently, as others have mentioned, for free. This is a huge win for my clients who are in foster care or transitioning out. Now they can claim their identity and take charge of their financial, educational, and career goals. We have the task of informing youth and advocates about this change. This is the first step towards more expansive access to vital documents for foster youth, so our work in this direction continues. I hope this change in eligibility requirements for applying for a birth certificate will be disseminated to my fellow child service providers across Pennsylvania. We entered this work to support and empower youth, and now we have greater ability to do so. In fact, we can give youth the tools to empower themselves. So thank you very much for having me this morning, and I'll turn it back over to Rep. Krajewski.
With that, that concludes all of our speakers for this press event. I want to thank everyone for coming out. Again, these changes are live. You can go on health.pa.gov right now. You can go to the forms section of that website, and you can see all of the forms we have, not just for applying for your birth certificate, but also for getting a waiver for young people that are in the disadvantaged categories. I want to thank, again, Secretary Johnson, all the representatives that helped us get to this point. Philly, right, for the work that they do every single day, for the young people that we are fighting for, and for bringing this issue to my office. And I also want to particularly thank Representative Mark Rozzi, because his bill, particularly targeting homeless folks and homeless youth, was a big part of us creating the bill that we were able to get across the finish line. So again, I want to thank everyone for coming out. And if you have any questions, happy to answer. But with that concludes our press conference. Thank you again. District that I love to call my home. We have a very rich and diverse community, and like many places in Philadelphia, we are dealing with a very real issue around gun violence. Have been lost to this crisis, and as we know, often the people on either sides of this issue are getting younger and younger. And so they brought this to me. They were like, Representative, these young people want to work. They want to access social benefits. As someone who wants to do everything I can to make sure another life is not lost, and particularly a young life is not lost, I really took that to heart. I worked with Philly disadvantaged youth to be able to access the birth certificates. And from there, we went to work. We're like, okay, we know this is going to be in the health committee. How can we actually work?
7,000 direction. Really, these important steps.
That sounds easy, but it's no small feat. Lawmakers, government officials, like everyone else, young people affected is squarely at the forefront of our minds. He met with countless members working to secure votes on a bipartisan basis. We're lucky to also have Secretary Johnson, who proved herself willing to take time to listen with an open mind and find a resolution.
But the entire state will be able to get the vital documents that they need. Each year at Philly, we work with about 400 young people, and less than 25 of them every year come in. And I appreciate all the young people who came here with us to advocate on their behalf for what they need. So I introduced Presley Garner because she is.
Thank you.
Again, I want to say thank you. As President Presley mentioned, this is a huge deal.
Public Health Management Corporation. My role involves working with first-time parents during the pregnancy until the time the child is 2 years old. I submit in foster care, transitioning out of foster care, or were recently in foster care. These young folks,
The population that we serve in Philadelphia. And I want to take a few seconds to talk about two different young people